All right, last one. This is going to be the hardest one out of the five. So here's the control. Here's phenyloxybenzamine. This is going to be an alpha blocker. Methylamine is a gang blocker. Remember, it eliminates reflexes. No reflexes. And then propranolol is going to be a beta blocker. So let's take a look at epinephrine, alpha 1, beta 1, beta 2, isoproterenol, beta 1, beta 2, norepinephrine, alpha 1, beta 1, phenylephrine, alpha 1, terbutaline, beta 2. All right, so now let's take a look at the systolic and diastolic thing going on right now. First thing is we know that the blood pressure goes down. So let's draw our little thing again, alpha 1, beta 1, beta 2, beta 2. So the first thing is we notice that the diastolic decreases, and the only thing that can really decrease diastolic in these cases is some sort of beta 2 action. So anything that has beta 2 is possibly an answer, and anything that does not have beta 2 is not an answer. So norepinephrine has a beta 2. Oh no, has a beta 1, no beta 2. Norepinephrine cannot be an answer. This is because beta 2 is the only one that can decrease your blood pressure. Phenylephrine is only alpha 1. It can only increase your blood pressure, so it can't be phenylephrine. So the only ones that could possibly be it is epinephrine, isoproterenol, and terbutaline. Next thing I want to look over is going to be propranolol. So when we take a look at propranolol, we'll notice that nothing happens. Nothing happens. So like, what does it do? It blocks beta receptors. Let's take a look at our beta receptors. If we blocked if we had blocked all the beta receptors and we put a terbutaline, which is a beta agonist, nothing would happen. That would make sense. It's all blocking it. So terbutaline is still in our differential. Isoproterenol, a beta 1 and beta 2, you eliminated both, you killed both, and then nothing happens. Nothing happens. So isoproterenol is still in our differential. And finally, epinephrine. Epinephrine, if you eliminate beta 1 and beta 2, you still have an alpha 1. If there's still an alpha 1, that would mean that this thing would increase your blood pressure. So it cannot be epinephrine. So the last two that it could possibly be is isoproterenol and terbutaline. Now, methylamine will be able to tell you the difference between the two, and this is how it's going to do it. So first thing is you have your systolic and your diastolic. Your systolic and your diastolic over here. What happens? First thing, the first thing I noticed was it was something about the blood pressure. This blood pressure over here is similar to the blood pressure when it starts. The heart rate. Sorry, this is the heart rate. The heart rate afterwards looks very similar to the heart rate before. This over here looks like it had some sort of reflex. And I think that the reflex that happened over here was a reflex tachycardia. And how do you do a reflex tachycardia? Well, I mean, what receptors would you have to hit in order to do a reflex tachycardia? What speeds up your heart? Beta 1. You have to increase your beta 1 in order to have a reflex tachycardia. So if you increase your beta 1 as a reflex, what would your systolic expect to do? You would expect your systolic to go up. All right, so with that in mind, if it were terbutaline, as I said, decreases both beta 2 and beta 2 equally, and this is what it shows in this ganglion blocker by itself. Why does the control look like that? Well, because when there was a reflex, okay, your blood pressure went down over here, your blood pressure went down, and then when the blood pressure went down, you had a reflex. The reflex was to increase your beta 1, and this is not a drug. This is like your body responding to the drop in blood pressure, and that typically is supposed to increase your systolic up to that point. So in this case, it seems to suggest that the answer is likely going to be terbutaline. But let's just make sure of ourselves. Let's make sure it's not isoproterenol. So isoproterenol by itself should increase beta 1 and beta 2 directly. So isoproterenol should increase your systolic by a certain amount, and then your diastolic to your diastolic and systolic would go down because of the beta 2. So the beta 2 would do this and the beta 1 would do this. So I would expect that this one should look like this with a ganglion blocker, because in this case it's a direct action beta 1. It's not a reflex beta 1. So this one I would expect to be terbutaline.